So the topic we are going to discuss today is about sexual issues. Do you know how sexual issues feels like? Well, let me tell you. Not conceiving after 12 months of unprotected intercourse, or lack of interest in sex, lack of erection or ejaculation, premature ejaculation in men, or lack of interest in sex, pain with intercourse, lack of orgasm in women. So these are all like the indications that the patient is suffering from sexual issues. On average, fewer than 10% of women under the age of 35 fail to conceive after 12 months of unprotected intercourse. After 35, the rate of infertility among women increases. So there are 4 important questions that you need to ask your patient before making a diagnosis. So question number 1, firstly, you need to ask the patient about failure of erection, testicular pain or swelling, vaginal discharge, abdominal or pelvic pain, pain on intercourse, irregular periods, genital lesions, genital discharge, genital pain, back pain, calf or buttock pain caused by exercise, anxiety, depression, change in sleeping pattern, appetite, change in bowel or bladder function, spontaneous erections, sexually transmitted diseases, results of previous semen analysis, pelvic examinations, and baseline temperatures or pelvic endoscopy. Question number 2. You should know if patient or anyone in your patient's family has had any of these conditions such as abdominal surgery, pelvic surgery, emotional problems, mumps, endometriosis, past pregnancy, sexually transmitted diseases, heart disease, diabetes, high blood pressure, infertility or sterility, prostate cancer, any recent surgery, nervous system disease, and history of sexual assault or abortion. Question number 3. If your patient is experiencing any sexual issues, or if the problem began recently or has occurred over a long time. You may also ask if you are currently experiencing any job or family problems. Now, one more important question you need to ask is about his medication history. If your patient is taking any medications such as blood pressure pills, antipsychotics, antidepressants, hormone treatments, or diuretics. Well, this is because this particular condition might be the result of adverse drug reaction to any of these drugs. Now that you are well aware of the symptoms of your patient, your main role starts here. You have to examine the patient. This physical examination includes pulse, distribution of body hair, looking for skin lesions. In men, checking size and consistency of testes, and opening of the penis, checking reflexes, sperm analysis. In women, pelvic exam, checking the genital mucosa, looking for vaginal narrowing, checking for clitoral adherence, and basal temperature. Now, what can cause inability to conceive and what is typical for each cause? Well, there are 9 different causes of inability to conceive that you should be clear about. Sperm problems, inadequate ovulation, reproductive organ problems, emotional problems, medication use, genital abnormalities, neurologic causes, hormonal causes, chronic disease. I'll be explaining these terms in a while. Number 1, one of the causes for inability to conceive is sperm problems. Well, it's few or poor quality sperm. Number 2, another cause of inability to conceive is inadequate ovulation. Well, it's an inability to position an egg in the right place to be fertilized. Moving on, third cause of inability to conceive is reproductive organ problems. Well, these are the problems with the fallopian tubes, cervix, or uterus. Number 4, if your patient is having troubled partner relationship, which is men can achieve erection but are unable to sustain it while intimate. Women either fail to reach orgasm or experience pain during intercourse. Well, this indicates emotional problem. It is due to stress, difficulty coping with life changes, or other mental problems. And if the patient shows symptoms such as inability to achieve erection or orgasm, well, this is due to medication use such as blood pressure medications, antidepressants, diuretics, spironolactone, some antipsychotic drugs such as Melaril. Number 6, if your patient is having pain on intercourse, lack of sensation, inability to achieve erection or ejaculate, this indicates genital abnormalities, which is problems with the genitals. Number 7, if your patient is having lack of spontaneous erections, loss of bowel or bladder control, well, this indicates neurologic causes, which is due to the problems with the nervous system, and this is uncommon. Number 8, if your patient is having abnormal distribution of pubic hair, well, this indicates hormonal causes. It's an imbalance of the hormones in the body. Moving on to the last cause of inability to conceive, which is if your patient is having problems with the sexual interest or functioning, sometimes associated with depression, well, this indicates chronic disease. It's any long-term disease causing inability to conceive. So now, if you're clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of sexual issues. Stay tuned to sqadia.com for more such precise and knowledge stuff videos. Bye-bye.